People are living decades longer, we all like this story, than they ever have before, thanks to advances in medicine and public health. So we asked some Californians to explain what old means to them.
The body is not quite as flexible, so it's a few more wrinkles. The first three words that come to mind when I hear the word old are retirement, menopause, and the beach.
I would say feeling old is probably when you turn 70, because the number is a scary number.
Usually lack of mobility, people that just kind of sit around and don't do much.
There is an upside to aging. I would say the knowledge you've gained through your life.
You start kind of appreciating family and community a little bit more.
I am not confined by limitations that society might have put on me when I was younger.
You just keep growing and changing and you become more wise, and I think that's the most beautiful thing about aging.
Retirement? Yay!
Dr. Louise Aronson wrote the new book, Elderhood, Redefining Aging, Transforming Medicine, Reimagining Life. In it, she says, we should look at the final third of life with the same concern: curiosity, creativity, and rigor as we view the first two-thirds. Dr. Aronson is an expert on aging and a professor of medicine. She joins us first on CTM to talk about her book. And we were all looking forward to this conversation. Earlier in the broadcast, there was an interview with a woman on the street who said about Joe Biden, you know, I don't know if I want an old guy over the age of 60 to run for president. And Anthony and I both sort of flinched. But I found your book to be encouraging and discouraging at the same time. I also think that the definition of aging seems to change for everybody.
It does. In surveys, the older a person is, the more likely they are to define age as older.
Right.
So we all basically define it in ways that enable our current selves. So younger people think youth lasts longer, and old age starts sooner, and old people the other way around.
And what's the reality in terms of what lasts longer?
The reality is, across all cultures and for millennia, everybody has defined old age as beginning between the ages of 60 and 70. Yeah. And that will surprise many people, especially people who are in their 60s.
Yeah.
But
you call this a transformative period.
It's a watershed moment in human history. So throughout all of human history, previously, we've had lots of children and a fair number of adults and very few older people. Yeah. And now the entire population is changing so that we're going to have about the same numbers of people in all categories and more older people. So we need to change our policies and choices, our worlds, our restaurants, our transportation, our healthcare system.
Our bathrooms.
Yeah.
Our bathrooms.
What myths do you want to debunk about aging?
Well, in the first place, the biggest myth is that it's horrible. Yeah. And it isn't. So in studies, they find consistently that older people are happier than adults.
Why over the age of what?
So you begin to get happier in your late 50s, and then you become happier still. And the happiest times of life are in the 60s, 70s, and early 80s.
Why is that?
Why is that? So there are a bunch of reasons. I think part of it is that people are comfortable with who they are. Mm-hmm. They're very clear on their priorities. They have moved through the stress of the most ambitious sort of sandwich generation years of adulthood. And they're just happier being who they are and making good choices.
Do you call it the sandwich generation because you're making school lunches every day?
Yes, that's part of it.
And there is a U-bend, and I think it's partly because of career ambitions and stress at work, but also because you're in the thick of it with small children. Right. You're making a marriage work often. What does medicine need to do? How does it need to change in order to deal with the fact that so many more people are 70 and above now?
Right, so medicine, like all other aspects of society, was basically built at a time where we had lots of kids and a fair number of adults. Mm-hmm. So let's take medical school, for example. It's 4 years long. You get a few months training about kids, and most of the rest of the 4 years is about adults.
A few hours training about older people.
About older people. And in hospitals, about 40% of patients are older people, and yet most doctors have hours of training in their care.
So if you go to the doctor and you say, my left knee hurts, and you're an older American, and the doctor is like, yeah, it's just age. What do you say? How do you push back against that?
Well, there was actually a real man.
I hate that, Louise. Yeah,
I hate that. But there was a real patient here in New York who had that experience. And what he said to the doctor was...
97-year-old man.
Right, 97-year-old man. My other knee is also 97, and it doesn't hurt me a bit. So that is a lazy doctor. That's what doctor not doing his or her job.
If we're lucky, we get a third act, and we really should embrace that.
Yes. Well, and it's one of the happiest times of life. It lasts for decades.
Yeah.
I mean, think of all the terms we have for childhood.
Yeah.
Infant, toddler, tween, teen. And we act as if old age is a singular state,
Right.
when in fact, from your 60s to your hundreds, you change. That's generations of a life.
Yes.
In old age, it's not.
Well, Tony categorized created a new category, super old today. So.
There are super agers.
But
That's
Louise,
a real
when
thing.
people say 60's a new 40, 70's a new 50, is that okay?
I actually think that's completely ageist, because what it suggests is that it's never good to be 60. That being 60 is only good if you're actually acting like and looking like you're 40. Whereas in fact, people at age 60 are much happier than people at age 40. So let's own that.
You know what? Super old now seems super fun to me. I'm looking forward to it. Dr. Aronson, thank you very much for being here. Elderhood is on sale today.